Welcome to our Ministry of Health Week in Review. Here are some highlights from the past week. On Saturday, August 17th, the Permanent Secretary of the Ministry of Health, Mr. Malcolm Watkins, along with the staff of the Health Ministry, participated in the National Cleanup Exercise in Georgetown. The activity was done in the vicinity of the ministry's headquarters on Brick Dam and its surrounding areas. During his brief remarks, P.S. Watkins emphasized the importance of upholding healthy and clean environments. Later that day, the Honorable Minister of Health, Dr. Frank Anthony, along with the Honorable Minister of Labor, Joseph Hamilton, visited the Better for Acton Health Center to oversee the eye testing and spectacles voucher distribution program. The ministers interacted with several residents who expressed their appreciation for the vouchers and the accessibility of services brought directly to their community. In addition to the Better for Acton visit, Dr. Frank Anthony also visited the Eccles Health Center on the east bank of Demerara, where a similar initiative was being undertaken. On Wednesday, August 21st, the Ministry of Health, in collaboration with the visiting delegation from the United States Center for Disease Control and Prevention, hosted a two-day workshop at the Ministry of Health boardroom on Brick Dam. Public health emergency management is a comprehensive discipline focused on anticipating, mitigating, planning for, responding to, and recovering from all types of public health emergencies. In his opening remarks, the Honorable Minister of Health, Dr. Frank Anthony, emphasized the importance of being prepared for public health emergencies by training more individuals in this field.
But COVID taught us that we have to be prepared. Our response to disease, whenever these things occur, was that we had an ad hoc setup. So, you pull people together and then you get them to start responding to whatever outbreak or disease that is confronting us. And I think what we have to do now is to move away from that ad hoc approach to have a more formal establishment and have people trained who can be responding to these things. This ought to be what they do every day.
Following this, Minister Anthony, accompanied by the Acting Chief Medical Officer, Dr. Jatindra Mohan Lal, met with the Deputy Group Business Development Manager, Mr. Michael Johnson from the Jamaica Social Stock Exchange. The meeting was geared at discussing potential collaboration between the Jamaica Social Stock Exchange and the Ministry of Health. Thereafter, Minister Anthony, accompanied by the High Commissioner Jane Miller, His Majesty Trade Commissioner to LAC, Jonathan Knott, the Caribbean Regional Director for Trade, Dejamila Ward, and Camila Nero of UK Export Finance, visited the maternal and pediatric hospital at Ogle to assess the progress being made. Thank you for staying tuned to our weekly review. Remember to take advantage of the Ministry of Health eye testing and spectacles voucher. The eye testing vouchers valued at $2,000 are being utilized by senior citizens and children. Should they require spectacles, an additional voucher valued at $15,000 will be provided to help offset the cost. Until next time, stay well.